This may be controversial, but there is a common medication that over 40 million Americans are taking daily that is destroying their mental health.
That's right. Studies show this medication prescribed by trusted doctors every day causes cognitive decline in 100% of the people who take it.
The pharmaceutical industry doesn't want you to know this, but we're about to reveal what could be the reason you're experiencing brain fog, memory issues, and trouble concentrating.
If you or someone you love is struggling with unexplained mental decline, stay with us for the next 25 minutes because you might be shocked to discover the real culprit isn't aging, it isn't stress, it's hiding in your medicine cabinet. So welcome everybody. This is Dr. Taj, a certified health coach and dentist.
And I'm Tracy, the Nutritarian Health Coach.
And we are about helping you wake up each morning full of energy, free of pain, and feeling healthier and younger without pills and more doctor's visits. Today, you got to understand that there is a hidden mental health crisis going on in our world. It's more and more prevalent than ever before. People talk about mental health. And so one of the culprits that we're going to talk about today is, well, what is contributing to that mental health. And as we look into it, we realize that there's 40 million Americans who are taking a medication that's decimating their brain function. They're all experiencing memory loss, confusion, cognitive issues, all without knowing why.
So what are some of the symptoms you've seen or
Well,
you're seeing?
Yeah, I think a lot of times when they see the symptoms, I think they're just dismissed, first of all, as, hey, that's normal. You're getting older. And
Yeah.
there's nothing to be worried about.
Yeah.
We all get like that when we're 50 and 60 and 70 years old.
Or I've heard the one, oh, so many people coming down with these, having all these mental issues. Wow, what's going on? Nobody's looking into it.
And that's a kind of sad thing because I think a lot of times doctors kind of are a little dismissive and they rarely connect the mental health symptoms to this specific medication.
That's true.
Yeah, it's like, oh, something's going on here. Let me give you a different medication. They only know what the true effects are.
On top of that medication you're on, they're thinking, okay, let me give you something to sleep. Let me give you something to calm down. Let me give you something for anxiety,
Yes.
right?
And it piles on to everything.
Yeah, you have depression. Let me give you something for that.
Right.
Yeah.
And so what are the effects? And I think that's where the medical system is failing in a sense because most patients receive no counseling about these side effects.
Long term too, because you have some medications people are on it long term, and no one educates or counsels the patient on the possible side effects.
Yeah, and I don't think it's necessarily a doctor's fault. It's just the way the system and the industry has been, I guess, I don't want to say kind of designed, kind of just been manipulated over time because you have these industry-funded studies and they systematically downplay the serious side effects. You have to really go look it up. And they play cute music on TV commercials. Oh, hey, if you have this, and death, and by the way, no, if you take this medicine, like, well, hold on,
These are the
death?
side effects, and they say it really fast.
That's right.
Or, stop. If you experience any of these, alert your doctor right away, including death. You're like, what?
It's not a funny matter,
No, it's
it's
not.
ridiculous.
It's crazy.
Yeah. So you got that, and I do think more doctors need to be more empathetic and really understand and hear patients' concerns. Because I think there are a lot of physicians who dismiss the concerns about what patients are feeling, cognitively speaking. They dismiss it.
Not to play a devil's advocate, but a lot of doctors are crunched for time because they're only given a certain amount of time with that patient, and half that time is monopolized with them taking notes to cover their butts.
Yeah, a lot of CYA there.
Yeah.
And it's all about throughput, got to
Right.
get them out, and it's not connecting to understanding what your true issues are. Because at the end of the day, they're kind of practicing medicine by just prescribing stuff.
Right, and according to their textbook, you have this. This is what you have. This is what you have, and we will give you a drug for that, and be on your way.
And you help. That's right on the point. And then this is what drives me crazy. I get so passionate about because that's the standard of care of our medical system. The standard of care is, hey, look, you know what? You got a problem? Hey, here's the pill because you have anxiety. But when you do that, you emphasize that one body part, but you sacrifice a whole nother body part. And with this particular drug, you're sacrificing the brain health. It's not good at all. And that's where it comes to like heart disease, is the pill that we're talking about. And so you want to have a real reality check. If you're talking about heart disease, it all begins with arterial damage. And that usually begins in the teens and early adulthood.
Wow. So it goes that far back.
It goes that far back. So it's not the fact that heart disease doesn't happen overnight. You turn 40. Like I had two of my best friend's two brothers passed away from heart attacks in their 40s.
Early late 30s, early 40s.
Yeah, and that's not just because it happened overnight. It gradually happened, and it's
Everybody wants to eat like they're still 14 years old, 15 years old, and they carry that into adulthood eating like that.
The problem is because you're eating like you're 14 or 15 years old all the way through. Yeah.
If that disease is starting early in teen years,
Yep.
oh my gosh, that's not good if your body.
Well, and that's exactly it. And as things go on, a lot of times the early warning signs are missed.
Yeah.
Even in mid-adulthood, like with women, you know how you go through menopause, and some women have it really, really bad, some have it a little bit lighter. Well, they have found through studies that severe hot flashes are correlated with the arterial damage, so the damage inside your blood vessels. So the thicker the blood vessel, due to all the damage over time, like 3 or 4 times more hot flashes, more severe than someone who has a healthy, healthy arteries.
Oh wow, I've heard that they're saying if you have severe hot flashes, like once you pass 60, it's like basically you have dementia at that point.
Interesting. So we're talking about this medication to help prevent heart disease. Is it dementia coming from the years of this drug?
That's what
It's a great question.
That's a good question to dissect.
A very good question. I like that question. Man, that's a great question. I got to look into that one. Man, so that's women. But you know what, men? With men,
Okay, what is that? What is
the canary in the coal mine
which is?
is they can't get it up. That's signs of some serious heart disease, cardiovascular symptoms.
Okay, erectile dysfunction for those of you who are not catching on to what he's saying.
Yeah, ED. Yeah. But again, that ED didn't happen just overnight. You know, it happened with damage progressing over decades,
Right.
over and over and over.
That's a problem.
Yes, that's a problem.
Right.
And so when you do get your labs back or blood work, like, oh my gosh, this is high, this marker is high. Our approach is to tackle it with medication versus addressing the root cause.
Right, because you'll still end up having that problem because you're not addressing it.
Yeah. And so here's the deal. I mean, the medication millions are taking that causes these devastating health consequences, they're rarely disclosed to patients. Here's some side effects of this pill, okay? This is crazy. So for the physical damage, there's like 19% increased risk of muscle or skeletal issues, of muscle or bone issues, injuries.
Oh wow! So people say, "Oh, you have osteoporosis or something."
Well, not so much osteoporosis, but it's like you could sprain an ankle, you could twist a knee, you could have
that type.
Yeah. Or you could 30% chance of dislocations, strains.
Wow.
So it weakens your soft tendons, your muscles, your ligaments, and so you're more prone to injury. Yeah.
I know some people who've had some injuries and required surgery in the last few months.
And more than
And they're pretty
likely,
young.
you have 50% chance of knowing that person is taking this drug.
Even if they're young,
About 1 in 50 over 40, what's considered young, but 1 in
like
50?
in the late 20s, early 30s.
Could be. I mean, could be. Who knows how quickly they put them on this drug now.
Wow.
But ultimately, about 1 to every, call it 50 people who are taking it, they're harmed. And that's just physically speaking. They're talking about the metabolism, how your body uses energy or converts energy. What happens there is this drug makes people increase their calorie intake by 10%.
So they eat more.
Eat more. Yeah, so if you say 2,000 calories is a normal diet, 10% more is 200. A pound of fat is about 3,200. So in 16 days, you increase your calories and you're putting on more weight. Also, because of this, you're increasing your fat consumption by 14%.
So you see a lot of people we see walking around with extra weight on, and it's it's their diet, right?
Yeah.
Which they don't change, compounded with the medication that they're on, and then they're gaining extra weight, way more weight.
Yeah.
And then this is why we see so many people walking around with a lot of extra weight on them.
Part of the problem, yeah, you got weight gain and you got BMI increases, all because of this urge to eat more fat and more calories from this drug.
Right. Instead of changing the way you eat and exercise and addressing the problem, the root cause.
And that's the problem with it. So it said addressing the root cause, which is poor lifestyle choices. This pill basically gives a false reassurance that you can take care of yourself without even addressing that root cause.
Oh, wow. Oh,
Yeah.
they think that's addressing the cause.
It's addressing the cause. So hey, I can keep living how I'm living because hey, I'm taking my pill.
Yeah.
And that's a lot of times that's my problem with medicines because it's a band-aid. It's not addressing it all. So that's the metabolic speaking. I'm not done yet.
Oh,
Oh yeah, I got more.
okay.
All right.
Enlighten
Organs.
us.
Organs. So when we talk about organs, now we talk about like the liver, severe to moderate dysfunction. We talked about muscles already. Muscles are kind of an organ as it's more tissue. Increased diabetes risk, cataract vision problems.
Oh my gosh, so many people have these issues. I remember years ago I was in a grocery store and this older lady was asking me a question. I think she wanted me to reach something, a box of pasta or something like that. And she goes, "Oh, I have to start eating whole wheat pasta because my doctor says I am, borderline diabetic." She said, "Look at me. I'm not big. I don't need, I shouldn't be diabetic." And I couldn't understand it. And now I'm wondering if she was on this particular.
It's not always one particular thing, but a combination of things together. And just the fact that you're taking this and hope to reduce cardiovascular disease, it adds more issues. That's the problem.
Right. So it made me wonder. It's like, oh, you're nowhere overweight. So why would you be borderline diabetic? Interesting.
It really is a puzzle. That's what it's why it's healthcare. It's not medical care, but people seek medical care often.
Okay.
And so when you think about this medicine, you really only have between a 1% to 2% chance of reducing a major cardiac event. So in other words, that means that you have a 98.6%, let's say, chance of not even having one to begin with if you're not even taking this medicine.
Oh my goodness.
Yeah. If you want to go even deeper than that, in order to have one person just benefit from this drug, you got to treat 400 people. In other words, that means 399 people would not even benefit from taking this drug. That's a 0.25% chance of having a benefit.
But they could all have the side effects.
They all experience notable side effects.
Which is a great plan for that company
to treat with more pills.
to distribute more pills.
Yeah, and so you get more problems, more pills, more problems, more pill, more problems.
It's a vicious cycle.
Yeah, and so the medication that's causing all these problems.
Yeah, please enlighten us.
I know,
Tell
if I
us.
said right, it's statin drugs. And what are statin drugs do? Those are the ones that prescribe to lower cholesterol.
Wow.
Everybody's so worried about cholesterol. Like, oh, my cholesterol is good. My cholesterol is good, all the time. That's what you hear about, right? Oh, my cholesterol.
Yeah, I hear that a lot of women, when they hit their menopausal years, if they, when they cross over, they have to watch their cholesterol. And a lot of times, because they're in menopause, their cholesterol goes up. It spikes. That's what they're told.
So interesting. Yeah, so these drugs, they're definitely marketed as like heart-saving medications. But I think people don't understand the consequences of all of them.
A lot of people don't. They just see it as, like you said, a quick fix. It's so you can continue eating and drinking what you want.
Yep.
And have and you don't think you have any consequences because I'm good. My numbers look good.
Yep. Yeah, and I think there's a big myth around cholesterol. They don't understand truly what cholesterol even is, or what it does, or the good behind it of all, right? Because they think high cholesterol is a disease that requires medication.
It's basically a symptom of what's happening inside your body, right? Which is your body trying to keep you alive. That's why you have the high cholesterol.
Well, it's
say that right?
No, you didn't quite say that right. Cholesterol is a natural substance in the body that you need in order to thrive, and I'll break that down even more in a second. But you cholesterol. No one has ever died from cholesterol. I'll put it that way.
Okay.
All right. So we've got the high cholesterol in your system, and so now because it's high cholesterol, it's more or less like a marker of something going on. You have high cholesterol. It's not a disease. So it tells you that something's happening. And so then you have these statins, they're presented as safe and essential for heart health because they say, oh my gosh, just bring this whole marker down, this cholesterol. When in effect, you still want to have cholesterol in your system for all the good things that it does.
We know so many people that have high cholesterol, friends and family. And I don't know, I don't ask if they're on statins, but some of them are and some of them I'm not sure.
Yeah.
And it makes you wonder.
50% chance.
It's like,
50%
you're
chance.
starting to see cognitive decline and you're saying, oh my gosh, it's dementia. Oh my goodness, you should be tested.
You're getting older.
You're getting older. Your parents had it, so chances are you're gonna get it, and et cetera, et cetera.
Yeah.
I'm seeing it before my eyes.
Mental health is a big topic right now, and it's not all what it seems, especially when you think about what the statins drugs do to have all these side effects.
And we see a lot of people act crazy or say crazy things, and I always say it's in the food. But part of it is probably because they're on that. The cognitive decline. They're not thinking straight.
Well, you're exactly right. I mean, it's a vicious cycle. It's the food, the medicine, food, and medicine, food, and medicine. And here's the thing. Here's the biggest thing of this all. For mental health purposes, it's a statins drug, like the Lipitor, Zocor, all those, is that studies show, these are studies that are high quality studies, not all the BS that's out there, that 100%, yes, I mean, every single person taking statins, they experience some kind of cognitive decline. Not 10%, not 50%, everyone.
Wow.
Yeah. Yeah, and it's universal. Zocors, Lipitors, it's all cognitive impairment. So it could be memory loss. It could be confusion.
Which I've seen.
It can just be difficulty concentrating, but some kind of cognitive decline is happening.
So the symptoms, are they in a range, or are they all people? Because it seems like everybody has the same thing, right?
Well,
would you say?
Well, there's
cognitive decline, whether it's
Yeah.
severe or not.
It's severe or not, because it could be really, really mild. Like brain fog, it's kind of mild initially, but it can be really, really bad. It can be really bad overall because you can develop real severe as in dementia presentation. Like I just they're gone. I mean, what's going on here? They forget everything, and there's more and more people who are experiencing that.
Yes, and they're saying a lot of younger people are experiencing that too.
Yeah.
Wow, that's
and so
crazy.
Yeah, so you kind of get back to your whole thing about the cholesterol, but is that the statins, your brain health needs cholesterol. It's like 25% of the brain is the body's cholesterol is in the brain. The statins cross the blood-brain barrier, which will then take the cholesterol from the brain and take it out. But see, you need that cholesterol because it's critical for the neurons in the brain, which is the central nervous system, the main processing center, for it to function.
Okay.
So you need it.
What good is it to slightly lower your cholesterol when you can't even remember your name or your children's name or your grandchildren's name, right?
Right. Why do it to yourself?
Yeah.
Yeah.
Yeah. I mean, I've seen it.
And that's precisely why I will never take a statin drug. I mean, what about you?
No. I rather do this. I'd rather get to the root cause and address it there.
Yeah, I mean, taking that drug, I mean, the guarantee of some kind of brain damage or decline is simply not worth it for me whatsoever.
Yeah.
Because you said we see it all the time. Many patients are diagnosed with dementia, have a different side effects, the physical, the metabolical side effects. And the good thing, I guess, is that a lot of times these cognitive episodes or declines, they can stop once you get off the medicine.
Really?
Yeah, you can start to kind of reverse its course.
So even somebody who's older, who's been on, I'm not saying that you would know, you diagnose anything like that, but it's like if somebody who's, somebody's grandma who's currently has dementia, but they've been on those statins for a long time, and if they were to get off those statins, the chances of them reversing that somewhat, is that any hope for that person?
I will say there's hope, and it's if it's been medically or medication induced. that caused the problem, right? We got hit in the head by a car accident, and
That's
of course, different. But if this medicine is taken for a long period of time and induced it, you can get some improvement. It can begin to slow itself and reverse itself. So yeah. So man, but here's what's the true revolutionary thing about cholesterol is that it's not the villain that it's made out to be. Now, I could talk about the brain health. It's just been completely just misrepresented. And so when you think about the high cholesterol, where does it come from? Because that's what you asked.
Right.
So one, it's because it gets high because of the high intake of animal foods. That's and animal foods are strongly associated with cardiovascular disease, but it's not so much the cholesterol itself.
You have so many people who are proponents of different diets where it's meat dominant.
And then, I got to eat more meat. The carnivore, the Atkins, right? All this stuff, I got to eat more meat. But here's the thing: the regions which have the plant-based diets have a drastically lower cardiovascular disease rate.
Well, yeah, because they don't have the high cholesterol because they're eating more plant dominant.
Yep, because the cholesterol is in the animal foods only, and then you have saturated fats, which increases the body's production of cholesterol. So a lot of fatty meats, a lot of fat oils, what have you, produces, when you have excess energy, it goes to triglycerides. That triglycerides then increases the body's production of cholesterol.
Interesting.
Yep, so that's why you have, but then the thing is, it's that the high fat, the high caloric, the refined food that raises triglycerides, but you couple that with a low fiber intake compared to traditional diets, then you talk about all the processed foods with high fructose corn syrup. That consumption increases the cholesterol as well. And so you have all this stuff, even like, healthy oils like olive oil.
Oh.
Yes. Like the monounsaturated, those may even impair the heart issue. So yeah, so those are all indications or destroy the arteries more so than cholesterol itself.
Okay.
All right? And that's when you get the plaques. Because you eat that type of diet, of course you're going to have a higher cholesterol in your blood.
Okay.
So that's why it is more of a marker than anything else, because cholesterol is not going to kill you. Cholesterol is just seen in the blood from the remnants of the type of diet you have, which will indicate, hey, you know what? You could have both heart disease and even like cancer.
Yeah, your cancer risk goes up tremendously.
Yeah.
Wow.
Yeah. So ultimately, the body will produce the cholesterol that it needs, and you don't need to have any more cholesterol from that diet. That type of diet has been shown to cause the cardiovascular disease.
The good news is that proven natural approaches to heart health that don't damage your brain.
Yeah. And what it comes down to is just a plant-powered approach. Evidence shows that plant-based diets can prevent and reverse heart disease. Yeah. You may lower the saturated fats, the cholesterol, the animal proteins, higher in fiber, antioxidants, anti-inflammatory foods.
Right.
And I mean, you're great with the foods that we got to eat.
Every day we have to have the G bombs. That's your leaf. That's your greens, your beans, your onions, your mushrooms, your berries, and your nuts, seeds and nuts. You have to have it pretty much every day. Eat the rainbow. Yeah.
And that reduces cholesterol better than any kind of statin drug.
Yeah. And you feel good.
Yeah. You feel good, and you're living a good, healthy lifestyle, and guess what?
No side effects.
The only side effect is better health. Yeah, you read my mind on that one.
No side effects, no cognitive decline, none of that nonsense. I'm not trying to make fun of it. I'm just saying it's like it could be prevented. It's so prevalent around us. So many people have it.
Yeah.
And that's what's heartbreaking.
And it all starts with the question you talked about. We ask a question, and we start looking into it more and more and more, and we start studying, whether through mentors or classes or diving into our own little investigatory process of studies. And when you discover this, after I discovered this, I decided, hey, yeah, I'm definitely not taking that statin.
Yeah, me too. Not when I get older, I'm not. If they try to put me on something like that, my blood work is nice and clean. So then again, is it? It is clean, but according to the American standards, it is clean. But I know it's clean because I don't eat that stuff, right? I don't put any of that stuff past my mouth.
Yeah.
But The guaranteed cognitive decline and other side effects simply aren't worth it when there's natural approaches
I'm
that's
with you.
so effective.
I'm with you 100%. And I don't want you to take this the wrong way because this isn't anti-medicine. What it is, it's just being pro-informed consent. You got to know the trade-offs between taking medicines and if you don't take the medicine, what are the trade-offs? Because there's really no perfect solution. Everybody has their own goals and needs, and really all it comes down to is, as a patient, I think people deserve to know the truth.
Right.
Hey, man, I'm not telling you to anyone to stop taking medication. That's between you and your doctor. But what I am encouraging, what we're encouraging, is for you to have that informed conversation.
That's right. And if your doctor dismisses your concerns without addressing the cognitive decline research, it may be time to seek a second opinion.
It's that simple. It
Yeah.
really is that simple.
Yeah. So let's summarize what we've covered today because we covered a lot.
Okay. I think the first thing we covered was the fact that statins cause cognitive decline in 100% of people who take them. That's for mental health. This is not good for mental health. The other thing was just the other side effects that can impact the quality of life outside of the mental health cognitive decline issues. And then because you're taking the medicines for like heart disease or preventing heart disease, is that the real cause of heart disease is primarily dietary and lifestyle factors. And the natural approaches, the G-bombs, baby, are more effective without the harmful side effects. And the only side effect truly is good health.
Yeah. Yeah. Who wouldn't want that?
I want it. I want to live to 100. I got another 50 years to go. I just disclosed my age. Oh, man. Just disclosed my age. Well, anyway, if you found this information valuable, please subscribe and join our newsletter.
That's right. Your heart and brain health matters. You shouldn't have to sacrifice one or the other. So until next time, be well.
All right, take care.